Looks like we'll give folks a minute to join. Good morning, Sally Fuller.
Hello.
41413 is here
413 is here.
all week. Been lots of 413.
Yep.
Um, Kristen will wait. And the first question, Kristen, I'm going to ask you is for you to tell us a little bit about you and how you came to be in your current role. And I will make sure you can share your screen if you have slides. There we go. Okay, so Kristen, I'll turn things over to you. I don't, are you also joining in?
I'm going to be listening and I'll help
Okay,
answer questions if there are some, but
great.
Chris is leading the show.
So just for 9:30 callers, Sally Fuller, Chair of the Strategies for Children Board, is here, and Ann Candelas has joined our board of directors as well. So Kristen, I'll turn things over to you.
Excellent. Thanks so much. I will put up my slides here. Where to see that? Excellent. Well, thanks so much for having me. Yes, I'm Kristen Joyce. I'm the new program director of the Bridge to Prosperity Cliff Effect pilot. I joined the team in March, and my background, I come from the research field most recently. So I spent 10 years at Mathematica as a senior researcher, and I was evaluating programs like the Cliff Effect pilot, really employment and training programs for low-income folks receiving public benefits, evaluating those programs to help them advance. And earlier in my career, I worked for the government. I was in DC as a TANF analyst, working for Health and Human Services, and I also had a bit of a stint at Mass DTA working on SNAP. I have been focused on improving public benefits programs for my entire career. And I really do this because I'm passionate about ending poverty in America. And I really see the Bridge to Prosperity pilot as a great initiative to help in that effort. So I'm really excited to tell you more about it today.
Great, thanks so much.
Yeah. All right. So as many of you likely know, the cliff effect occurs when a worker who receives public benefits, to make ends meet, ends up making a little more income, and then they end up losing more in public benefits to the point where they're actually worse off financially. And research has shown that the cliff effect actually impacts the decisions of upwards 40% of workers receiving public benefits. And
Wow.
it really traps them in poverty. And we know it also impacts employers' ability to retain workers and fill workforce gaps. And we know that this is impacting the early educator workforce as well. And so we are working on a solution to the cliff effect, the Bridge to Prosperity Cliff Effect pilot. And in 2022, after years of advocacy, we received seed funding from the Massachusetts State Legislature and have since raised additional funds from private foundations and donors to launch the pilot. And through the pilot, we're aiming to invest directly in 100 families and supporting their journey to economic prosperity. And we're serving participants from the greater Springfield, Worcester, and Boston area. And we're also focusing on serving Black and Latino residents because we know those groups are disproportionately impacted by the cliff effect. And the pilot has four main components, which really build off the evidence of what works to support low-wage workers trying to advance. So we're providing bridge payments, monthly bridge payments of between $300 and $700 a month to our pilot participants over 2 years. And that's really to bridge that gap as they're earning more but losing public benefits. The program offers participants one-on-one financial and career coaching, and that's really designed to help them navigate those cliff effect barriers and help them with reaching their employment goals. And then a third and really important component of the pilot is we're partnering with employers, and that's really to help ensure that program participants are on career pathways to living wage jobs to the extent possible. And then after 2 years, the pilot participants are receiving a $10,000 asset building bonus. We should really see that as a transformational opportunity and investment in these families that then they can use to invest in themselves and their children. And we are implementing the pilot with several partners. These are our coaching partners. We have three partners in each of the areas of the state. So in Western Mass, we're working with United Way Pioneer Valley, in Boston, Women's Money Matters, and in Worcester Community Action Council. We work with Up Together. They have years of experience providing the back end to distribute the cash to families. So they are supporting us with the bridge payments. And then right now, our employer partners are Bay State Health and Boston Medical Center. We're actively working to expand into other sectors and working with other employers. And importantly, we are evaluating the pilot, and it's really to build the evidence of, how best can we support families in navigating the cliff effect and transitioning from public assistance to permanent employment. We're working with UMass Boston Center for Social Policy and Dr. Susan Crandall for this work. We have several evaluation questions, thinking about how do monthly payments and career and financial coaching affect participants' capacity to manage the effects of benefits cliffs on their career advancement, financial stability, and well-being. And importantly, we have a couple questions related to systems and policy change. So how does current state and federal policy contribute to the existence and nature of the benefits cliffs? And then what do employers know about benefits cliff, and how can they lessen the impact of the cliffs on their workers? So this is ongoing work with the evaluation. We'll have early findings early next year. And we're planning to share these results widely with policy papers and impact reports and convenings, local, state, and federal, because really our end goal is to eliminate the cliff effect and to do that both through state and national policy work. We've mentioned before, I know Anne has been here before, that we co-lead the Economic Pathways Coalition, and that's really to help advance this work in Massachusetts. And then nationally, we're a part of the Beyond the Cliff Coalition, and there are many states. It's an expanding group. We're actually just expanding to 50 states and organizations around the country that are working on this issue. So we are in coalition with those folks to try to make federal policy change as well. And so I can share update on our progress so far. So we launched our first cohort this past February, and we're now serving 18 families across the state in Springfield, Worcester, and Boston. Our participants on average are 38-year-old mothers of two children who are the heads of their households. 67% of the women are Hispanic and 28% are Black. So far, we've distributed $64,000 directly to these families, again, to bridge that benefits cliff gap. And all of the women are meeting with their coaches, receiving support, and connecting with the resources that they need. And we've heard from our participants that the pilot's already making a positive impact in their lives. Participants have been able to start pursuing career dreams that they really haven't been able to do before, save for an emergency, pay off debts, and rely less on public benefits. And this is a quote from one of our Springfield participants. She said, "A few months ago, this all felt out of reach. Now, with support from the Bridge to Prosperity pilot, I'm not just dreaming of becoming a nurse. I'm taking real steps toward it and toward building a stable future for my son." So we're excited to talk a little bit about, our next steps related to the early educator workforce. So we're actively planning and fundraising to be able to serve a cohort of early educators as we're looking to expand this work as we continue this year. And our planned process for this is we're planning to partner with a few early education providers who can then refer their workers to be considered for the pilot. And these workers would be those who face a cliff effect barrier to advancing and have a career path to be able to advance. And as part of this work, as part of our planning work, we've been analyzing how the cliff effect might impact early educators in Massachusetts as they try to advance using example salary ranges. So we do this using online tools. So the Atlanta Fed has some tools that can be used with workers and just generally for analysis to map out how the cliff shows up. So we've been using that to understand how this might impact early educator workers.
And Kristen, can you just
Yeah,
really break it down? So I think most people know what the cliff effect is, but can you give like
sure.
an example of like and what you've heard from participants?
An example of how this shows up.
Or yeah, just like what it really looks like.
Yeah.
I mean, yeah, just so people have
Yes.
a complete understanding.
Yes, absolutely. Yeah, so we often have an example that we share, a woman in Naisha in Boston, but she explains that she has two twins and she took on some extra hours around the holidays and then ended up immediately losing her healthcare benefits and her childcare benefits. An example of the childcare, she says, she got a bill for $5,000 for her twins because these benefits really are supporting folks with, as we know, with these really hard barriers and expensive costs that many people struggle with, but certainly on low income, it's hard to pay for your childcare and your housing. So, folks will, and again, in the low wage workspace, you end up maybe taking on more hours because you're able to do that. But then your income determination goes up when you go back to DTA or the housing authority, and so then they realize you're over income and you lose your benefits or decrease them. And so this hits a lot at the $22 an hour
Right.
amount is where a lot of this hits. And so people are getting trapped at the $18, $19 an hour. You want to get up to 22, and often it's a step, right? To get to higher earnings. It's hard to jump from a $19 an hour job to a $40 an hour job without support. And then you're trapped on the way because you
Right.
lose all the public benefits to the point of being way worse off. So again, we can map that with our tools to say, like, if someone in this sector took a couple dollars more, and we can, it's different because of how many children you might have or where you live. And that's what makes it complicated because all of these programs are very specific to different family types, but we can at least have the tools to help understand and help people make career decisions.
And it is exciting because we have heard about the cliff for early educators for many years that kind of every
Yes,
time we make progress when we think about salaries, thinking about the impact of that to other benefits. So thank you for that example.
exactly.
And then yes, this is really exciting to hear about.
Yes, no, that's so helpful. And that leads me to the other point of part of this net mapping process is to think about, and this is part of our general work with having employers at the table, like what benefits, how can the employers, right, help
Right.
fill the gap? And so we can look at that as well. Well, if we took childcare off the table, if employers can provide childcare, of course, if you get employer health insurance, then you don't have to rely on the public system. So
Right.
that's part of again, sort of the mapping and trying to understand what might this look like. And of course, hopefully having more of those discussions with the state and again at the federal to understand, how we can make bigger change in this area.
It is the push and pull of the whole system, right? Like how all these pieces are working together or not.
Exactly. Exactly.
Yeah. Anne is also answering questions in chat, which I'm monitoring, Kristen, but you can keep going and then we'll have time.
Okay,
Yeah.
perfect. Yeah, I can't see the
One
chat, so
thing
thanks
I
for doing
just
that.
wanted to one thing I just wanted to say was it's not a system at all. And I think
Right,
that's
that's true.
Mm,
we yeah, we call it a system, but it's really a bunch of disconnected programs, right? So
yes. And that's things we think about. I mean, again, that's a huge effort, but more coordination would be, a policy recommendation, right?
Right.
To bring these together and think holistically about it. Um, But as with the entire pilot, our ultimate goal with including early educators in the pilot and this sector is really to be able to include the employers in the sectors in our advocacy work when we're thinking about how to eliminate the cliff. So of course, it's a great opportunity to be able to support workers in the sector, but we'll also have the opportunity to make a bigger impact for more workers and more families by illustrating how the cliff is impacting early educators in the sector specifically. And then, we have opportunities planned. We've already been doing it, but going forward, we have a big emphasis on elevating the lived experience. So any early educator workers who will be able to participate in the pilot will also have the opportunity to participate in our direct advocacy efforts and help with thinking about these policy recommendations. So we're excited about that piece of the project as well. And just to say, we're pursuing funding opportunities to be able to do this. We're looking at funding specifically for this piece of the project, and seeking other funding opportunities as well to make this happen.
Great.
My
Okay,
final
looking
slide
ahead.
for looking ahead. So we're aiming to enroll 82 more participants this year. As I was saying, we're looking to expand with other employer partnerships. We'll be doing another round of evaluation data collection this fall. And then our policy advocacy work is in progress. Ann and I are going to DC in just a few weeks to be working on the federal side. And we have a policy paper planned for early next year.
That's great. And we know Titus Sastromedius from Strategies for Children serves on the on the steering committee, which is we feel very fortunate to be kind of part of the work and to hear the updates. So let's go to the chat. Nikki Preston says, "This is such great work. Thank you for your effort. In your research, are you capturing the impact of individual coaching sessions versus the financial support in relation to career growth success?"
So this is a qualitative learning evaluation post for, teaching us about the program and some outcomes. I don't think we'll be able to isolate the impact specifically of coaching. It's really the whole program, but we'll be asking, participants and coaches about, their perceptions of the coaching and how it has helped them for sure. But we won't be, isolating the impact of the coaching itself, if that answers the question.
And Titus and I were able to go to an event at the Boston Foundation. I think it was in the spring, and it was so incredible to hear the stories of people who had been part of this pilot and just kind of talking about the coaching piece and the financial support piece.
Yes.
That coaching as well. Sally had asked, is the focus primarily on health careers? And Anne answered that question in the chat, and so did you, Kristen, that you're expanding to other sectors that have a disproportionate number of workers impacted by the cliff effects. Titus said, would love to see the cliff effects pilot expand to early educators. We'll never fix our workforce challenges if early educators turn down raises and promotions to avoid the cliff. Lots of opportunity in our sector. Kim Dion shares for EEC financial assistance. If you qualify for 1 year voucher, which is a lot of families, their parent fee cannot rise during that 1 year, even if the income goes up, which has really helped. We know that policy is newer, but it has been very helpful. Of course, at the end of the year, the fees may go up with the next reauthorization, but in many cases, families have a little time before the fees rise. Very different from even a few years ago when parents had to report income changes within 30 days and parent fees would rise commensurate to that income change right away. So that's a really good example of how a policy change really has had a good impact. How will early educators be chosen for the pilot?
Yeah, so again, we're looking to expand to 100, so it is or 82 more, so it is a small pilot. So we'll be working with just a few employer partners. So we have through Women's Money Matters, we've been talking to a provider in the Boston area, but we are still building out that. But we're planning to again build some partnerships with just a few organizations, as we are only a handful of employers. But the plan is to recruit specifically from that employer because it's really we know the importance of having folks connected to a job and a career pathway, and this is really about advancement to try to move them up. So not getting people into new jobs. So we are looking. We're saying it's an incumbent worker model. So again, it will be a select group. Through our partners that we're working to develop now. So at this point, we're not. It won't be an open opportunity. But again, we're hoping to learn from this and. Who knows? There might be an opportunity to expand in the future, but that's our plan now. Again, will be a sort of appointed partnership and a small group of sort of select participants from the employer partners we select.
And then Natalia adds, thank you for the incredibly meaningful work you're doing with the Bridge to Prosperity pilot to rethink America's safety net and remove barriers for families. The cliff effect can be especially devastating for parents with infants and toddlers birth to two when childcare is most expensive and least available. How can pilots like Bridge to Prosperity address the childcare cliff, especially for families with babies and toddlers, ensuring that wage gains don't push them out access of care during those first critical years?
Yes, I think that's such an important issue. Thank you for raising that. I think, I think in general, again, our this pilot, so we're supporting folks financially. Great to hear that, if you're receiving, a benefit, you won't lose it, but understand that this is a specific, age range. But really our work, so we're supporting people financially, but really our work is to raise issues like this right through our advocacy, that we can elevate that. And the hope is that, we can show that things like this are impacting working families at a larger scale to hopefully make policy and systems change. And like we said, with employers as well. So, part of what we're trying to do is help elevate this work, right? And share the stories of mothers who have young children who have these issues and can't advance. That's how we see our part of this puzzle. So hopefully we aren't, specifically supporting people with this one issue, but hoping to elevate that this is an issue, to make bigger change.
And Anne is encouraging you in the chat to talk about your research on the importance of next level employer role.
Yeah,
Somebody
absolutely.
asked about
So,
coaching, so I thought it'd be good to talk about, the model that we've developed actually is backed by some research as well. So, yeah.
yeah, absolutely. So I worked on the federal evaluation employment coaching, in my former job, so that was federally funded. And what we found, one of the things we found, so the hope was that employment coaching, which it did find that it can help with self-regulation skills, which is really important for
Hmm.
workers, like on the job. But what it found, it didn't move the needle on employment on its own. And what
Hmm.
we heard from workers is that they really need that connection to employers, the extra training, really help me get a job. So really that concrete connection to employers. And so what that research suggests is that the next stage, what we really need to be doing is combining strong evidence-based coaching with connection to employers. And so that is what we are, doing here and building out and testing. So I do see this as really as the next generation of that work, and based on the evidence of what hopefully will help, with advancement.
Great. Let me go to the chat. Um, Andrea Parker also shared that she missed sharing the mic this week, but on LinkedIn there's an important research resource that's being shut down, so it's important to go and download papers. So there's a site around research around, I think it's early childhood, which is going to be removed. So the link is there if folks want to investigate that. Um, Sally Fuller says, thank you for this incredibly impactful work. Proud of the 413 and Ann Candelas and Kristen's work, since Ann worked very closely with us at the Davis Foundation in Springfield on the early education sector. Feel free, she and her team are expanding the work to a new level. And so I guess, Ann, you want to talk a little bit about how this work fits into the bigger picture of Springfield Works and what you're doing?
Absolutely. One of the things we really saw and how we got connected to this work was actually through employers. It was employers who had identified that people were unable to, or first they said not willing, and we know that that's not true, were not willing to accept promotions, accept raises, move from per diem to full time, move from being a substitute teacher to a regular full-time teacher. There were a lot of different examples of from the employer's ears on why on this issue. And so over time, what we learned was that, there was a very good reason for people to say no. And the economics of this really bad policy, frankly, is really came to our attention. And we said, you know what, we have a really great emergency safety net system. We have some, a fair stabilization, a lot of work in stabilization, but mobility, people's like legs are cut. It's as soon as people start um, making gains, they're unable. And we saw in some of our early research with employers, there were also you could see where retention was an issue and turnover. $21 an hour, $22 an hour. People are hit really hard. And so to make that leap to next level through a series of promotions is really difficult. So we wanted to build something that demonstrates mobility and investment, not investment for for 6 months, but somebody over a 2 year period. I mean, I'd like
Right.
to do it longer, but
Right.
those are the funds we have. So it's really important to us to say, how do we actually drive economic prosperity and economic independence over a long term with the right supports? And also, we've added a lot of work around the live voice of experience, and
Hmm.
that has really helped us shape a better program, a better product, and they're part of our advocacy work as well.
Thanks, Anne. Daisy wonders, how do people interested in the cohort apply? And then is there an age requirement?
Thank you. So there's no age requirement. The eligibility is you need to be a parent, a working parent, and receiving a DTA benefit. And as I mentioned, on average, our participants are older in their later 30s, but there isn't a specific age requirement. But as for application, as I mentioned, we're working at this point to partner with employers, so it will be sort of a closed application process within a specific employer. But there may be opportunities in the future, so we would certainly loop back if it becomes an open application. But at this point, we're planning to recruit, kind of again select with employers, so it wouldn't be an open application. And we'll determine how best to do that with each of the employers based on their preferences.
And we would love for you to come back anytime. And as you can see, there's a lot of 9:30 call interest in this topic. Thanks to everybody who kind of asked questions and added context in chat. It was great to have you here this morning, Kristen and Anne. So please come back. We'd love to hear as the research is, as you have more information about that. And I know we had talked after the event about maybe having a panel of folks who have had the experience, like as Anne said, learning from that lived experience about how this kind of policy and this pilot are working to impact real lives. So we'd be happy to have that discussion here on the 9:30 call as well. Okay, so this is Thursday, so we don't have a call tomorrow on Friday. On Monday, I think we've shared that Mary Beth Mioto, the president of the Massachusetts chapter of the American Academy of Pediatrics, will be here. She popped on yesterday. I hear there is also a meeting today around vaccines, so I know those questions are coming up. We're gonna have Jessica Acevedo on Tuesday, sharing the mic on Wednesday, and then Liz Sweet from Mira will also be here on Thursday next week, and we'll ask for questions and what people are most interested to hear from Liz next week on the call. Thanks so much for joining us, and we will see you next week. Have a great day.
Thank you. You too.
Thanks, Anne. Thanks, Kristen.